And as we reach the culmination of today's program and the programming for this year, it's my pleasure to welcome on Dr. Satjit Bhusri from the Upper East Side Cardiology and Vein Institute, and to quickly round us off by talking about one of the major topics within digital health this year and the last year in particular, around harnessing AI specifically in today's practices, and for Dr. Satjit Bhusri with a focus around cardiology and vein care, of course. But Dr. Bhusri, thanks so much for taking the time to join us on the program today. We'd love to hear more about yourself and what you're doing with the Upper East Side Institute.
Hi, Jerry. Good to see you again. Thanks for having me on. So I'd like to talk about where we left off when we last met was embracing digital health. And that was after COVID and really going into how we used virtual cardiac rehab. We also use a lot of digital health tools, which after COVID really became part of our lexicon and really advancing good healthcare, availability to healthcare, access to healthcare. And to circle back on that, we kind of hit another revolution this year, which was artificial intelligence. And you can't really turn the corner without hearing that in every facet of our lives. What I like to discuss a little bit today is how we've incorporated and implemented AI into our practice. We're a small practice on the Upper East Side, but we're very productive and busy and really like to embrace technology. And as we continue to embrace that, we try to embrace artificial intelligence starting in the early, probably the second quarter of this year. And the great news with healthcare is that since the adoption of digital health and the digital health revolution, access to and barriers to having accelerated utilization of these methods have become a lot easier. So the main focus that we seen in our practice, and it's something that we're going to see adopt by major healthcare systems within the next year, is the utilization of artificial intelligence in our compliance with our notations, our dictations, our submissions to healthcare insurances to apply proper coding and reimbursement, and to not have any more necessity of auditing and really backlogging of both claims and payments. And in addition to that, the ability to have a longer face-to-face conversation with our patients without worrying about the notations, worrying about will we get paid for this, worrying about whether or not the patient will get charged for this, and allowing those minutes spent with the patient to be with the patient eye to eye. And so in April, we decided to look into various platforms that utilize AI. And the one that we adopted is a platform called Freed.ai. Mm-hmm. And it's fantastic. So essentially what it is a scribe, a virtual dictation system on my phone that also has a desktop app platform website. And so what this shows is that basically when I go into the patient's room for a visit, I click record on the app, and it transcribes verbatim our interaction and records everything verbatim. But then it applies AI, and what it does is it develops a succinct history of present illness, a physical exam, and an assessment and plan that is appropriate for the level of care that we provided that day, the time that we spent with the patient, and as a result, creates these wonderful notes. Now, they're not perfect, and we have to understand that this is still still in its nascent stage. But what's great is that as I continue to proofread and incorporate these into my notes, it's starting to learn my vernacular, starting to learn my style of noting. And since April, it is adapted. It's definitely adapted to the level of care that I like to provide and the level of care I am providing and the way I like to speak and approach patients. Mm. There are some minor quirks still. Physical exam is very hard. Vital signs are very hard. But most importantly, objective findings, such as echocardiogram results, EKG results, even vital signs and physical exam, it still has a way to learn. Outside of that, the subjective history of present illness and the plan that we want to create moving forward is fantastic. It's resulted in very minimal auditing this year. It's resulted in higher reimbursement, and it's resulted in higher patient satisfaction because we have more of this, and less of typing and worrying about I need to go to the next patient and I have all this backlog that I need to do, and I may not even get paid for it.
Yeah, no, absolutely. I think you've hired some really good technologies that you're already using to improve and streamline the way that you're able to actually engage with the patients and deliver the care that you need to, and have, like you said, important, back and forth conversations and interactions like this. Well, just to round us off, Dr. Bhusri, before we close up, because we are at time, unfortunately. But have you noticed any sort of challenges specifically that you've encountered when integrating some of these tools into your current sort of workflow?
Yeah, I'd say, the two challenges. One is that they're not integrating into your EMR. They're working on it. Obviously, it's a very fast-moving target. But yeah, now we're working with separate applications, so we have to start moving data from one to another, and that could be a little tricky. And the second thing is we can't completely rely on this, right? It's still very nascent. It's still trying to learn while we're trying to learn with it.
Right.
But it is adaptable. But as long as we don't take the human aspect out of our utility of dictation and note submission and bill submission, i.e., proofreading and really putting your own tone to these notes, I think this will adapt, and it kind of becomes your own little colleague that adapts with you, or your own personal scribe that knows what you're going to do next and knows how you want things to be written.
No, that's brilliant. Dr. Bhusri, thanks so much for coming on the program. We know how busy you are, and I see you probably in the middle of some patients right now, as I can tell from your video. But thanks so much for coming on the program to at least briefly speak with us about how you're sort of harnessing some of the AI tools that are readily available that other physicians could potentially look into using as well. But really appreciate you coming on as always. Hopefully we get to have you back again in 2025. And if you're attending the summit in December, we'll see you then as well.
Great. Thanks for having me, Jerry.
No, thanks so much.